Hello and welcome to this presentation to help develop an awareness of speech, language and communication needs. My name is Andrew Middleton and I'm the Inclusion Manager at ISS. So this presentation will go through a definition of what speech, language and communication needs are, the difficulties that there can be with language, some strategies to promote development in this area, some important points to remember, the way we baseline in this area at ISS, and some further resources. So defining SLCN, it's the term used to describe difficulties with the following: producing speech sounds accurately, stammering, voice problems such as hoarseness or a loss of voice, the understanding of language and being able to make sense of what people are saying, and using language within words and sentences. It's also when interacting with others, being able or not being able to read the rules of good communication, or where language is limited and it's not able to be used in different places. So, some language difficulties associated with this need. Sometimes, if there is a language disorder, it can be a result of an underlying condition such as autism or having hearing loss, or physical disabilities such as a cleft palate, or medical conditions such as cerebral palsy or Down syndrome. Sometimes a language disorder is not linked to any of those conditions, and in this case it's called developmental language disorder, or DLD. And for either of those reasons, early identification is crucial. It's often easier to identify if there is an underlying condition, and it's more difficult if it's just a developmental delay. But in early identification, we can then try and provide appropriate and timely support. And as mentioned in the EAL presentation, language difficulties in this area are different to having EAL, because like I said in that presentation, if the young person who's EAL was learning in their home language, there wouldn't be any language difficulties. So some ideas and some strategies to support young people who have speech and language needs. So think about the environment they're in, both at home and school. Is it language rich? Is there lots of opportunities to develop language in their routine? Are there books and posters on the wall that visualize language and words? Moving on to having more visual resources and information. So in some of the other presentations that I've put together, things like graphic organizers and visual representations of information will really help these learners understand whatever it is we're teaching them or we're showing them. In more extreme cases, there might need to be an adapted communication system, perhaps at first or as an intervention. So where the young person is using pictures and symbols more, and it might be starting at the level of just making choices and then moving on to communicating using pictures and symbols, and then hopefully developing onto using language. When working or when around the young people, consider your own use of facial expression, body language and gesture. If they do have difficulties understanding speech and language, they will find those factors easier to read. So sometimes we can communicate in ways other than words, and that will help them understand the way we use those things. Keep language simple, so use words that you know are easy to understand or that they do understand. Don't present lots of speech or language or communication at one time. Break it into chunks, and think about, going back to the environment, can they focus on you clearly? Can they hear you clearly? Is there not many distractions around? So keep things as simple as possible to begin with. So as I've said in some of the other presentations, it's important to remember that sometimes strategies will work really well, and then sometimes they won't work at all. And sometimes it will change on a regular basis. So something that is helping them communicate or understand speech suddenly won't work anymore. And then you have to be flexible. We have to think creatively about why that is. Patience is key with speech and language, because we need to keep, as I said, we need to keep it simple. We need to keep it on their level, and then sometimes that can be difficult to contain. So just try and be patient. I'm sure they are trying as hard as they can to help to develop their speech and language, and we have to help them with that. And it's really important to remember it's such a big area of school and life that the extra effort that we all put in early on is very much worth it, because language is key in everything that we want them to do and in everything they want to do in life. And young people learn very well, and it will get easier. So stick with it, be persistent, and like I said, remain patient as much as possible. It will be difficult, and you won't understand everything, but things will get easier as we work together. So at ISS, we are able to baseline young people that we feel might have difficulties in their speech and language. We've got an assessment tool that can be used with our primary students. It's called Welcome. And when we've gone through it, if they're found to be behind in this area, it also has an intervention package that we then share with staff for them to use. And we hope that by identifying issues early and by intervening early, that Welcome testing later on will then show the progress that they have made, with the eventual aim of them catching up and being at their expected level of communication in regards to their age. Sometimes, though, we will speak to yourselves as parents and families, because further assessment and intervention will be required in this area. So that could be from a speech and language therapist or an educational psychologist, or it may need specialist assessment, but we'll always work with you on that and then support you with any information you might need. So just to finish with some further resources for you to look at, as a useful video on YouTube, you can just type in DLD123, and that's two young people, two 9-year-olds, talking about developmental language disorder in child-friendly speak, and a website there under the title Let's Get Chatting, which has got lots of links within it and ideas and resources for young people up to the age of 5 that might have speech and language needs. Thank you very much for listening and watching this presentation. I hope you found it useful, and I hope you got some ideas to help develop speech and language needs if required. Thank you.